Episode number 63 of the Wholesome Fertility Podcast. Welcome to the Wholesome Fertility Podcast. I'm Michelle, a fertility acupuncturist here to provide you with resources on how to create a wholesome approach to your fertility journey. So today's guests are actually a couple named Larry and Belinda Wurn. They created something called the Wurn Technique, and it came out actually from a very interesting story. In 1984, Belinda Wurn learned that she had cancer of the cervix. She survived after months of radiation therapy, but the treatments left her lower abdomen, pelvis, and lower back adhered and scarred. All of her pelvic organs had adhered to surrounding tissues and structures, limiting her mobility and causing significant pain. So with her husband, Larry Wurn, they searched for relief by studying with physicians and physical therapists around the U.S. and abroad who did different types of hands-on techniques. So after taking many courses in manual physical therapy, they found their first glimmer of hope. The manual techniques improved the pain. Together, they developed a protocol of over 200 manual therapy techniques called the Wurn Technique, and opened their own clinics, first personal touch physical therapy, and then Clear Passage Physical Therapies. By 1990, they discovered that the therapy could open blocked fallopian tubes when a chronic pain patient became pregnant, despite being infertile for 7 years. They continued to treat women diagnosed infertile and found that despite high FSH, advanced age, or complications from PCOS or endometriosis, they had excellent results in achieving pregnancy. After several case studies and scientific publications, they have the data to support these incredible claims. Larry and Belinda have never had a child of their own, but through their physical therapy clinic, they treated thousands of women by clearing the internal adhesions causing their fertility struggles. Lo and behold, these women successfully conceived after their natural, holistic, hands-on therapy. You could definitely say that Belinda and Larry created over 1,000 miracle babies. So welcome to the podcast, Larry and Belinda.
Yeah.
Thank you.
Hi.
Hi.
Thanks for having us.
Absolutely. You guys have such an interesting story. I would love for you to share how you came up with the Wurn Technique. It's actually a really cool love story.
It is. You want to start, Sugar?
Yeah, sure. Well, I've been a physical therapist since 1975. And in 1984, I developed cervical cancer. And by the time they found it, it had grown toward, the tumor had grown from the cervix back toward the rectum. So they were scared to do a hysterectomy. So they were very aggressive with me with radiation. So I had to go 5 days a week for 8 weeks for 40 external treatments. And that shrank the tumor in half. So then I had to have 2 internal radium treatments where they put radium pellets in this stainless steel tube and surgically implanted it the full depth of my uterus. And I had to lie still in a lead-lined room for 72 hours. And I had to have two of those 2 weeks apart. So killed the cancer, and I'm still here 35 years later.
Thank God for that.
This is. I mean, I can't believe we let them do this to her. This was just the start of the story. But the nurses would say, "Here, you're going to have to. It's dangerous for us to. We'll bring you food, but it's dangerous for us to be in this room for more than 5 minutes at a time.
Wow.
But we're going to keep you here for 72 hours. But don't worry, we'll keep you drugged."
Bionic woman.
Yeah. Wow.
Oh, it was awful.
Yeah.
Draconian.
And so it was. And I developed what's called a frozen pelvis, where all my organs were glued together. All the organs in the abdomen and pelvis were just glued together. So I couldn't work for about 3 years. I had intestinal problems, pain with sitting, pain with intercourse, sacrococcygeal pain, and it started spreading up my back. And I got straight A's all through PT school, and I didn't know what to do for myself to get out of pain.
Yeah.
So we asked doctors, we said, what are we going to do? She's, those are adhesions, internal scars. You get internal scars whenever you have had a surgery or an infection or any sort of healing event. Endometriosis is a major cause. There's nothing we can do about that. You don't want us to do surgery there. That's, in such a private and sensitive, highly innervated area, will just cause more pain. You just have to learn to live with it.
Mm-hmm.
Right. So I saw, I don't know, 6, maybe 7 or even 8 different specialists. And I got really tired of hearing it's all in your head or you have to learn to live with it. And at 33, that was not acceptable.
Yeah.
So I started traveling all over the country, getting treated by therapists that did different kinds of hands-on techniques that I'd read about in the 2 weekly PT publications. And anyone that helped me, I started studying what they did. And then Larry got tired of me traveling. So he studied with the same people and kept treating me and got me off pain meds and out of pain and ready to go back to work full time. So
Wow.
that's when we opened. Yeah, it was. We opened our first private practice in December of 1989, treating complex chronic pain people with headaches, neck pain, back pain, pelvic pain, like that.
So in the beginning, Michelle, we weren't thinking a whit about infertility. We weren't really thinking of doing anything but getting my wife, who was my childhood sweetheart, out of pain. But after this experience, Belinda said, Larry, there are other people out there, women and men, who have pain from adhesions. I just feel like this is a calling. I need to help them. And I said, oh, okay, well, I'll help you if you want. So we had no intention of treating female infertility, but
didn't think about it.
We just weren't thinking about it. And then suddenly women that came to us that had blocked fallopian tubes, their tubes started opening and they started having children.
That's amazing. That's amazing.
Yeah, it really was. I mean, the first woman who got pregnant was within our first year of practice, like in 1990 or so. And she had a work-related slip and fall injury. So we were treating her for headaches, neck pain, sacrococcygeal pain, and pain with intercourse. And she had a fibroid removed from her uterus years before. So she had a real keloided, a real bumpy, lumpy scar. So she asked if, while we were treating all her other areas, if we would treat her scar. And so we said, sure. So she came in one day and said, Belinda, you're not going to believe what my doctor told me the other day. And I said, what's that? She said, I'm pregnant. I said, that's great.
Oh my
said,
God,
that's great.
I just got the chills. Wow.
And she said, no, you don't understand. She had the HSG dye test done 7 years prior. So she knew both of her tubes were totally blocked. And so she hadn't bothered with birth control. So it was a big surprise.
That's miraculous.
So this started happening again and again. A friend of ours, a physician, said, do you think you have anything to do with that? And well, we're treating there a lot. He refers some other women, some with blocked tubes and some just had been infertile for several years. And most of them became pregnant. So we wrote to the local gynecologist. It's a very medical area here. We're at the University of Florida Medical School. The GYNs in town, we wrote to the gynecologist and told them, we were helping with intercourse pain and that a lot of women with blocked tubes were becoming pregnant. So the chief of staff of the hospital calls me in and he says, Mr. Wurn, I'm a gynecologist surgeon for 30 years. I do surgery twice a week. What is this about opening blocked fallopian tubes? These claims you're making? I handed him a half a dozen charts. He looks at one. He looks at another, he picks up the third one. He says, Mr. Wurn, you're doing things with your hands I don't think I could do surgically. And I'm a really good surgeon.
Wow.
Is that okay? He says, yeah. He says, it's really good. Are you doing any research on this? No. Would you like to? Yeah, sure. He said, well, how about this? I'll offer to be your research director. I'm not going to charge you anything. I think this is important for women. And I think we need to publish some research on this. And so he joined us, never charged me a cent, never charged us a cent. And he was with us for about 30 years. He finally left the hospital. He was chief of staff.
Wow.
And just stayed with us because he was so fascinated. So that was sort of how
incredible.
Where it all started. So,
yeah, wow, that's quite a story.
It was totally an accident. But then, we kept seeing more and more women with blocked tubes and, a good majority about 69%, we were able to successfully open at least one of the blocked tubes, and they were able to get pregnant.
That's amazing.
So do you want to hear what happened next?
Yeah, absolutely.
Okay. So the next thing that happens is we're going along. We're trying to keep data on the tubes that we're opening, and it was really neat because for science, you want to be able to provide objective results. Well, with blocked tubes, we could provide it because the women could get a dye test beforehand, an HSG it's called, and we could see that both tubes were blocked, and then they'd get a dye test afterwards, and they'd either be still blocked or they would be, one or both would be open. And then we could measure how many were getting pregnant. So we could get really objective data and start publishing that. Then this woman calls up Belinda and says, Belinda, anybody ever tell you anything embarrassing, anything unusual?
After treatment.
After treatment. What is it? Well, it's a little embarrassing, she says. Well, Belinda says, are you going to tell me or what? The woman says, well, tell you the truth, after I came home, now that I'm home, I'm in my mid-40s, I'm having orgasms like I've never had before.
Oh my God. Oh, wow.
Belinda, being appropriately medical, says, well, is that okay? All right. Yeah, she says, but it's just so unusual. I thought I'd mention it to you, so I wanted to let you know. So this happens about 6 or 8 times, and Belinda asked me what we should do with this information. I said, honey, don't even mention it. We're already the weird practice in town. Let's just keep that under wraps.
That's great.
We need to add more.
But the chief of staff finds out about it. He said, you're kidding. He said, that's really important. It is? Oh, yes. He said, we can actually measure sexual function. And as gynecologists, we have nothing that we can really do to increase orgasm, desire, lubrication, arousal, or decrease pain. Really, I mean, if we can't decrease pain by desensitizing agents, we tell a person she just needs to see a psychiatrist.
Or have a glass of wine.
Or have a glass
wow.
of wine. Well, you know.
Oh, wow. Yeah. Wine's always good.
Yeah.
Right.
So he said, we need to do so because, I mean, if you've had pain with intercourse, it's not in your head. You know exactly where it is.
Right.
So he said, we need to do a study on this. Oh, we do? Yeah, we do. Gosh. Okay, so we did a study and we increased all 6 of those domains statistically in all six domains and presented it at the American Society for Reproductive Medicine, published the abstract, Fertility and Sterility, and so that's sort of been the main side effect of treatment.
It's a good side effect.
Yeah. So along the way, we hired a PhD, a double PhD, and asked her, why are we having this much success? And I want you to examine this. Well, she couldn't really answer that without first seeing where were we having success. And then about 3 years ago, we published a study of 1,392 infertile women we had treated. And she divided them up for the ones that had blocked tubes and the ones that had endometriosis, the ones that had high FSH, which occurs when a woman is approaching menopause. And she got our results, and then she compared them with surgical results. And they were, in most cases, equal or better than surgical results.
Wow.
And so we published that in a major journal. Christian Northrup wrote the foreword to a book for us. She wrote Women's Bodies, Women's Wisdom. You may know of her. She's been on the New York
Times she's amazing
bestseller list for a long time. So I'm
trying to get her on the podcast.
Yeah.
But it's not very easy.
She's a busy lady.
She's a very busy woman.
Yeah. She's busy.
Right.
Yeah.
She's great.
Yeah. But at least now we felt an obligation to be able to look people in the eye and say, these are our results, and they're statistical, they're peer-reviewed, they're published by physicians and biostatisticians, because it's easy to say, I bet I can help that, but it's nice. Right,
but you have proof, like solid proof.
Right. So
wow, it's incredible.
Yeah. So, what else? So we grew. We started training. We had this gentleman from the National Institutes of Health who came down to study us. His son was a physician in our town who was seeing all these tubes that we were opening and said, "Dad, you've got to check these people out." And he came down from Bethesda and moved to Gainesville, Florida, where we are. And I said, "Dr. Wakeman," and I said, "How many hours does it take for us to help these women that are infertile?" He said, "Well," he looked at the results and he said, "You average 16.2 hours for treating blocked fallopian tubes." And I said, "Well, what if we do a
Wow.
20-hour program? Because people are now trying to come to us from all over the U.S. and other countries." And so we designed a 20-hour program so that people could come in and start Monday morning, get 2 hours in the morning, 2 hours in the afternoon, and be done Friday afternoon. And so that's what we've got about a dozen published studies out now in medical journals. So that's where a lot of our data, that's how it was born.
That's fascinating.
It's been
I mean, it literally is how it was
Yeah.
born.
literally,
Yeah, right.
literally,
Exactly.
it's been a remarkable adventure.
That's incredible. I mean, it really is. And it sounds like it found you guys.
It did.
Yeah. Yeah.
We weren't looking for it at all.
Yeah. Which is kind of how the fertility world is. I've spoken to a lot of professionals, and it's kind of the same kind of thing. It finds them.
Right.
Yeah.
And it's a pretty miraculous work. I mean, it sounds like what you guys are doing is tremendous.
Yeah.
And the fact that you guys have actually studied it is very unusual, because not everybody has, even the coincidence. Well, I don't really believe in coincidences of how you met the doctor.
Mm-hmm.
Everything kind of worked out in a perfect way to really show the possibility of this,
Right.
which is incredible.
We were so naive in the beginning. We were treating this one woman who had pain, and it was the very beginning, I remember, and she said, "I can't believe my period came. I didn't even know it was coming, because I have had pain every month since I first started having periods, severe pain, and because I have endometriosis." And we said, "Oh, that's I'm so glad." And the woman laughed, and Belinda and I looked at each other and said,
What's endometriosis?
What's endometriosis? Because that's when we came to realize that with endo, wherever the endometrial implants land or are found in the body, adhesions generally form. And we believe that the pain comes from that endo swelling pulling on those endometrial strands. They're like the strands of a nylon rope. Because when we treat it, the results treating endometriosis, we don't think we get rid of the endo, but the pain decreases and the function increases because things aren't glued down anymore. So fertility increases. So that's what we think's happening there.
That's incredible. So your technique, can you describe it?
Do you want to go into that, or do you want me to? Go ahead.
Yeah, sure. So all the organs in the abdomen and pelvis are supposed to be able to slide and glide over and around each other as they function and as you do all your daily activities. And as we go through life and have either surgeries or traumas, and we look at lifetime trauma because it's cumulative. Car accidents, falling down steps, snow skiing, falling. Also after infections and after inflammatory conditions such as endo or Crohn's, and after radiation, the body lays down adhesions, which is internal scar tissue, as a normal part of the healing process. But the way the adhesions form is they not only heal the areas that were traumatized or cut, but they form sort of like a spider web. So they can and do start sticking to anything and everything in the vicinity, causing pain and decreasing the ability of some of the organs to function at 100%. So with our hands, we check all the organs in the abdomen and pelvis for restricted mobility. And we also...
And you could just feel through it to see that it's not moving the way it's supposed to.
We should be able to put our hands on any organ and stretch them in any direction, like a clock, and
Got it.
becomes really obvious, where things are stuck. We also check scars, and we check for restricted soft tissue mobility throughout the body. because these adhesions, I mean, they can spread from the abdomen or pelvis into the low back, down into the pelvic floor, the buttocks. They can
Mm.
pull upward into the chest, the upper back, the neck. So if you could picture your body being knit like a sweater, everywhere that you've been cut or had endometrial implants or infections, it's like there are some runs in the body stocking. So with our hands, we check for restricted soft tissue and organ mobility, and wherever we feel things are stuck, we'll
Mm-hmm.
we'll we'll stretch those tissues and structures into the direction they don't want to go until we feel a resistance to the stretch, and that's the adhesions. And then we
Mm-hmm.
wait for the tissues to soften. So it's like layer by layer, we're gradually peeling things apart that are stuck together that shouldn't be. And as the tissues and
Mm-hmm.
organs can move more freely, symptoms start to get better and go away, and the organs can function more normally.
That's amazing. And you also, I'm sure, allows the body to be able to process it and kind of clear it out as well more easily than when it's completely stuck.
Yeah, it's like taking the body back in time from when these little glue-like straitjackets formed in the body. They formed when we first needed them because you had to heal from a condition, and so it contained
Mm-hmm.
the area that had been injured. But once that area has healed, you have an antibiotic, or you've healed from the surgery. Most of
Right.
them aren't really needed anymore, but the body doesn't have a way to get rid of them, so they stay
Right.
there like glue.
So you basically assist the
That's
body
correct.
Exactly.
in getting rid of it. And then the body will be able to not be as overwhelmed and be able to kind of eat it up.
We think what happens, we know with these strands, Melissa, that are very strong, they attach to each other and to the underlying structure with molecular chemical bonds. We believe that what
Mm-hmm.
happens is we're detaching those bonds, and we probably are detaching at one end of the strand or the other. That strand then
Mm-hmm.
becomes loose and can lay down on the cell that it's still attached to. Collagen covers every cell in the body, and
Mm-hmm.
and and that's so they don't really go free and go throughout the body. They just stay where they are. It's kind of like pulling out the run in a three-dimensional sweater where the strands don't really go anywhere, but the run
Mm-hmm.
goes away. If that makes sense, Michelle.
They're
Right.
just not stuck
Yeah.
together.
And also, I mean, the body's able to technically break down things, but sometimes it gets overwhelmed with a lot. So it's harder, but it sounds like you're also helping that. I bet. I mean, we can't go in there and see it to that degree, but they do it with the visual, but I'm sure it also helps the body break it down. Have you ever heard of serapeptase?
Yes, yeah. We've treated many, many people who have taken that, and I know it's supposed to help break down adhesions, but um, that alone, in our experience, isn't really enough. I mean, these adhesions are a real mechanical roadblock or restriction, and we feel that these mechanical restrictions need to be freed up mechanically, and then taking the serapeptase as well. Um, it should work better.
Yeah, I thought it would be. It sounds like a great conjunction because yeah, you're right. I mean, and for something that's so thick and has such heavy scar tissue, to get serapeptase or do it through supplements, I don't think would be enough. But I think it sounds like doing both is
Yeah, I think
ideal.
they definitely would be complementary. Um, again, we're breaking up these roadblocks so then the body can do whatever it needs to do to heal itself. So, breaking up these adhesions frees up lactic acid into your system. It's a metabolic waste product.
Hmm.
It's the same stuff like if you haven't worked out in a while and you go to the gym, you work out, you get sore. It's from that same lactic acid. So we just
Right.
the body's it's toxins. So we suggest that while people are having our treatment, they make sure to drink a lot of water, and that helps start to flush that
Hmm.
stuff out of the system. And also throw a couple of cups of Epsom salts into a hot tub every evening and soak for about 20 minutes. And that helps pull the toxins out of the
Hmm.
system. So to help minimize any soreness they might get from the treatment.
Yeah. Wow, this sounds amazing. I wish I had you guys
I
close to
know,
me.
yeah, I know. 365 miles is pretty. It's close, but not close enough.
Yeah, I wish you guys were like right here. It would be great because it's such a great resource. I mean, I can think of so many people that could really, really, really utilize what you guys are offering. It's
Thank
incredible.
you. Yeah.
And that's always been that for me, as an acupuncturist, fertility acupuncturist, it's that for me is a challenge. I mean, as much as like we were talking about the serapeptase, yeah, we can do so much when it's physical obstruction through herbs and supplements, but it only goes so far. And so having this technique and to be able to actually non-surgically be able to open up these passages, it's incredible.
Well, the thing is, you're an acupuncturist. The acupuncture meridians run through the fascia. So by which is our connective tissue, like if you could pick like a sweater. So, as we free up the mechanical restrictions, the acupuncture will be able to work much more
right, because correct, we do increase blood flow and we do activate the meridians, but even with that, blocked tubes are they're just so challenging. But to be able to mechanically massage it and do what you guys are doing to like release it, it just would be such a great compliment to what I do.
Absolutely.
Right. You're about the balance.
That's amazing.
Yeah.
So there's one of the things that occurred, and it's not actually infertility, but it's such a good continuation of the story. This rock and roll singer calls us up from California. She says, I've read about you, your studies about opening blocked fallopian tubes. Can you open larger tubes? And I said, what are you talking about? Well, I've had 7 surgeries for bowel obstructions, which are life-threatening.
Started with endo.
Oh, wow.
And hers started with endometriosis.
Yeah.
And they're scheduling my 8th one now.
Wow.
They're going to do a Whipple. They're going to remove half my stomach and everything, my gallbladder and everything they said that adhesions could attach to. Can you help me? I haven't eaten a solid meal in 12 weeks. And we said, well, makes sense. We probably can, but I don't know. But she said the problem is every time I have a surgery, when the same thing happens, of course, with endometriosis or any other surgery,
right.
no matter how brilliant the surgeon or compassionate or wonderful, they can't help but create adhesions. So it makes more adhesions. So we treated her 11 years ago. She canceled that surgery. She's not had a surgery since then. We just published a study in the World Journal of Gastroenterology, a control study showing that we decrease recurring bowel obstructions by 15 times the norm. So it's been really, we never planned any of this. I was ready to retire a while ago, but I can't.
Can you clone yourself? I would love your clones. Just kind of parked right here.
We wish.
Wow, so many people could use you.
Yeah. We wish we would have figured this out when we were in our 20s instead of in our 40s,
Yeah. Wow, what a gift. My God, it's amazing, because all of these things seem to not have much of treatment other than surgery.
And it becomes a snowballing thing. Surgery, adhesions, and then how many times can you be operated on?
Exactly. Without a doubt.
We've treated people who have had 10, 11 surgeries. And it's like, my God, what was the surgeon thinking that was going to be different this time,
Right.
It's always the luck of the draw, too. You hear of women that some women go through and they'll have a surgery for endometriosis, and they do fine with it. And some women have surgery for endometriosis and they're worse from due to the adhesions. And it's just like I said, the doctors, they can't really predict.
Right. It's a spiral.
Yeah. So.
Wow. I have somebody that I may even convince her to come out to see you guys.
That'd be fine.
It's Yeah, she could definitely use your services. I mean, it's incredible. I'm just in awe, really amazed by all of this information that
Well,
you're
and
telling me. I mean, I read
we
about
do
it
have a
and
location closer to
yeah.
you in
Boca, yeah, in
Boca
Boca.
Raton. We've got
Hmm.
3 in
Oh,
California,
okay.
a couple of them in England, New York City, and St. Louis. So we have a few.
So you guys
Yeah.
you train other practitioners and you're doing a practitioner
Yes,
certification?
I got in a bad car accident in 2001 and couldn't work again for about another 9 months. So what, I was getting treated every day and started right. And we had many physical therapists contact us and say, how can we learn what you do? So I started writing a
Mm.
therapist training manual and it turned into a 4-year OCD project. It's now about 550 pages. It took 4 years and it's still
Wow.
gradually finding more and more edits. But anyway, we put together like a clinical internship training program for physical therapists who have a certain number of years of experience doing hands-on work, and they have to love it. It's time consuming, um,
Hmm.
but
Yeah.
yeah. So
Wow,
we've
that's incredible.
certified 12,
Yeah, about
15.
some 12 to 15.
Yeah,
Yeah, we handpick them because we want them to be excellent, especially
successful. Yeah.
with the bowel obstruction. You're either
Yeah.
helping someone have a child or you're helping save their life. It's really we have
Yeah.
a need to know that they're going to be excellent or we won't accept them. So
Yeah.
yeah.
That's amazing. I'm so amazed. I'm just thinking about so many people right now in my mind. I'm like, wow. Okay, so the closest to here is
The
Boca.
therapist we
Hmm.
trained who's in Boca. Yeah.
Yeah.
Okay, that's great. Great to know.
Everybody just
Yeah.
we invite people to look at the website, which is Clear Passage, clearpassage.com. It's full of information. We're not going to try to convince somebody to come. It'll give them information. They can
Yeah.
apply there, and we review their medical history, and we say, we think we can help, or we don't think we
Hmm.
can help. Um,
Right.
and then if they say, well, okay, uh, where would you like to go? Well, I'd like to go to, I live near New York, or I have a sister in San Francisco. Um,
Yeah.
and so in that, there's no cost for any of that. We just go ahead and apply if you think you're liable to be interested, and we'll review it and have a conversation with you on the phone and let you know what we're thinking.
It's interesting. I'm like thinking as you're talking and you're talking about how obviously it has some nice side effects. I imagine also that it would, with the increased blood flow, it'd also be very calming, and it would also help hormone balance by doing so because you're dealing with the sex organs and that area.
Yeah. The I have to tell you a story along that line. So we're treating these women that are coming with all sorts of infertility diagnoses, and meanwhile, the chief of staff of the hospital, he's now a medical director for us. Again, totally unpaid, and we're just consulting him.
Hmm.
And we said, Dr. King, we have these women that are approaching menopause. They have high FSH. Do you think we can help that? And he said, "Yeah, no, Larry." He said, "I can see where you're helping sperm meet egg, but that's just hormonal. I don't see where you're going to be able to help that." So we refused those women for several years because we didn't think we could help
Wow,
them. Woman
it's
comes
amazing.
in, when your FSH is above 10, you're refused IVF generally. When it hits 25, you're in full menopause,
According to the
according to.
reproductive
Mhm.
endocrinologist. Yeah.
So this woman comes in. She's got a lot of pelvic scarring, a lot of pelvic pain. We were treating her. And while we're treating her, I noticed her cranial bones were really not symmetrical. And I thought, well, should I spend some time working at her cranium? And, she really came in for
Hmm.
this other. I did not know that she had been refused IVF the prior 3 months because her FSH levels were so high, 18, then 19, then 28. So I thought, well, I'll just take 5 minutes. And so I did that on Thursday and then again on Friday, along with everything else. Of course,
So you did the
we
cranium,
did the
Craniosacral, both cranium.
cranium.
Yeah.
craniosacral.
So
Uh huh.
we're at both ends we're at the pelvis and the coccyx and the cervix and work our way up and we're in the cranium. So she goes home, totally diagnosed, totally infertile, it refused IVF, gets pregnant the next month. And
Oh my, naturally.
Naturally, yeah.
she goes to her doctor and he says, "You can't be pregnant. You're in menopause." She said, "I assure you I am." And she was. So I went back to Dr. King and said, "So Dr. King," Belinda and I said, "Well, what do you think? Should we treat these women or not with a high FSH?" And he says, "Larry, not only should you treat them, but get their FSH levels before and after therapy, and you'll find out if that was a fluke or if you." So this is the scientific method where you kind of test it. So I said, "Okay,
Right.
how many should I get?" "Well, I don't know. Ask the biostatistician." So we called the head of biostatistics at the medical school, and he says, "Well, the more the better, but at least 6." So we had a couple of years go by, and we started accepting those women and getting their FSH levels before and after. 2 years go by, and I said, "Well, let's look at that." I had a little bit of a breather, and I had the PhD look at it. And she says, "Well, you've treated 16 of them." Said, "How did any of them, their FSH levels go down? There any?" "Well," she says, "6 of them got pregnant before they got a chance to have their FSH levels checked."
Wow.
And
So whatever about the FSH in
yeah,
that case.
of the other 10, 9 of them, their FSH levels went down. In most cases, they plummeted, and there were only 16. And the first woman, she is now pregnant 2 years later with her second child, naturally. So we went,
Oh
"Oh
my
my
God.
God,
Wow.
this is cool.
That's amazing.
This is some of the neatest numbers of all." So we're looking at that, and would like to move on to Parkinson's after that. Some neurosurgeons suggested that, wow, if you can help that pituitary, that's a half inch away from where the Parkinson's
That's
occurs in the
incredible.
brain. So anyway,
So you did this with craniosacral
yeah,
therapy.
added to
what
the
we
protocols
do.
as a small part of the adding to the
I
protocols
see.
of what we do. Yeah.
That's amazing. I mean, interestingly enough, I don't specialize in this, but we do Chinese medicine. There's some people that specialize in scalp therapy,
Really?
and they help people post stroke. It's usually beneficial if it's right after, if you get it early.
Wow.
But they help Parkinson's. That's interesting.
Wonderful.
You might want to actually find also kind of work with an
That would be
acupuncturist
great.
close by you that does scalp therapy. That I think you could. I mean, the sky's the limit at that point. You
Right, yeah,
combine
true.
everything
What a
one
great
after the
idea,
next. I think that it would be like
Yeah,
incredible.
Yeah.
that's a great idea.
What a great idea.
Yeah.
It's amazing.
Yeah.
I'm so fascinated by what you guys are doing, and I'm fascinated by the story of how this all came to be, and the fact that, thank God, Belinda, you're doing really great, and
Thank you.
this is all a memory. Everything
Yeah.
that you've been through.
Thank goodness. Well, and Larry didn't mention that after my car accident in 2001, I was getting treated daily for a couple months, and I was always saying, treat my neck, treat my back. I wasn't having abdominal or pelvic pain. And in hindsight, that was really dumb, because 20 years after my radiation, 6 months apart, I had 2 total bowel obstructions. So I've had the last 3 feet of my small intestine and my ileocecal valve cut out.
Wow.
Because we had been all that time, we treated, back in the beginning, we were treating her pelvis. It never really occurred to us that all of her abdominal organs were unprotected by that radiation that was inside of the uterus.
Right.
And so we never treated there. So got the pelvis all mobile and squishy and everything moving right. But then we're surprised to find that she was all adhered. She had adhesions in her.
Wow.
Yeah, from the radiation.
Yeah,
right?
from the radiation.
It just took a long time before it became a problem. Yeah, I mean, we see a lot of people, a lot of women, especially, who've had laparoscopies, fibroid myomectomies for removing fibroids from the uterus, and some of them start having pain from the adhesions from the surgeries pretty soon after surgery. Some may go 3 months, some may go years before the adhesions become problematic and causing pain. So it's interesting, and there just doesn't seem to be any rhyme or reason to know which people are going to do great with surgery and which ones are going to have problems down the road.
Right. I guess you can't predict how the body's going to respond.
Exactly.
And the challenge for them is that they start having pain, and adhesions don't show up on any diagnostic test,
Right.
MRI, CT, X-ray.
They're
They go
soft
to
tissue.
Right.
Soft tissue.
They're soft tissues, collagen everywhere in the body.
Right.
So they go to the doctor and they say, "I hurt here." Well, I don't see anything, or there's nothing there, or like they told Belinda, it's
Right.
all in your head. When it's not in your head, but they can't. So it becomes extremely frustrating to go from specialist to specialist with this pain. Their friends are maybe thinking, "Well, you're kind of a hypochondriac. You don't have a neck brace, or
Yeah, you look fine.
you look fine." When inside you've got
Right.
these 2,000 pound of square inch straitjackets squeezing on organs, and it kind of drives them a little bit. It was incredibly frustrating until they
Yeah.
figure out, hopefully,
Yeah.
oh, these are adhesions. This is what happened from when I had that surgery 15 years ago.
I'd like to share a story of a woman that we saw a few weeks ago. She had stage 4 severe endo, and 7 years ago she had surgery, laparoscopic surgery, and they removed as much endometrial implants as they could. I mean, we sort of picture the implants looking sort of like blisters on the different organs, and she before before that surgery, ever since she started having periods, she would be in so much pain around ovulation and the first couple of days of her period that she would miss 4 days of school a month and then 4 days of work a month. And after the surgery, she had pain all the time, not just 4 days a month. And she had excruciating burning pain in her rectum with bowel movements, with her bladder, with urination. And when she would walk, she would have excruciating rectal pain. So we treated, and she and her husband had not had penetrative intercourse. They would do it twice a month, right when she was ovulating, and she'd be in excruciating pain. So her homework Wednesday night was, go home and you guys have sex. And
we started therapy on Monday.
We started therapy on Monday, and because we want to know, that'll give us a couple more days to know what was different, if it hurt less, if how was it different.
Right.
So they came back the next day and were glowing. They had intercourse, and sex didn't hurt at all.
Oh my God!
And by the end of the week, she had
that by itself is a gift.
And she's wanting to get pregnant, right? And the rectal pain was gone, no pain with bowel movements, no pain with urination. And when she walked, she no longer had the adhesions, the pain pulling into her rectum. So,
she had been looking to find out what was causing her pain for how many years?
7 years.
7 years. So
and nobody could point her in the right direction. Nobody can tell her.
So frustrating.
Wow,
and so miserable.
It's very frustrating.
No life, really. Now she has a life.
Yeah.
Wow, that's incredible. Well, that is a life. So I, for you guys do mostly adhesions and after surgery. What about somebody who just comes in for fibroids?
I don't think we can help fibroids themselves. What do you think?
Yeah, I mean, we're not going to shrink them or anything. We just will make sure that all the uterus is freely mobile, that none of the ligaments that attach the uterus to the pelvic bones and the sacrum and tailbone are restricted. So, I mean, that alone can help decrease the pain from the fibroids, but
right. A lot of it's hormonal too, so it kind of takes it to, it's a lot more complicated with fibroids.
Right. We do well with PCS. One of the surprises we found was that in this 10-year study of the nearly 1,400 infertile women that we treated, that when the ones that we treated before IVF, their pregnancy rates increased really dramatically, with statistical probable p-values in the 1 out of 1,000, 3 out of 1,000, if you know what those are. And the women that were over 40, it increased their pregnancy rates 3 to 5 times what the national statistical
That
averages
is
were.
incredible.
So
Wow.
it was nice. So if it didn't help them become pregnant naturally, or if they just wanted to have IVF because that was quicker,
Hmm.
it increased those success rates, and that is statistical. It's on the website.
That's
All
amazing.
these
Because I do get a lot of women who come in and after failed transfers, and it's devastating. I mean, they go through everything, so many different things, and they finally get to the point where they have a healthy embryo, and then it fails,
Right.
and then they have to go about do it again, and of course, acupuncture also. You get a lot of blood flow, but to see that you actually got studies done on this and it's showing to increase it is such hope for so many women.
Yeah.
So, and you can imagine having acupuncture, Chinese medicine, and what we do to address the mechanical aspect.
I think it would be great.
Yeah, right. Yeah.
It would be a beautiful marriage.
Yeah. Yes,
That's
you're
right.
right.
Yeah,
That's right.
it'd be great. That's why I want you guys here. You ever think about moving here, South Florida?
No.
No.
I lived in Boca and Deerfield back in the 80s.
Hmm.
We're up here on a lake. We're out in the country. We like it. It's a lot
get
quieter.
Okay, yeah, it's comfy.
Yeah, we have change of seasons somewhat.
Yeah. Oh, that's good. That is nice
Yep.
to have a little bit of a change.
Yeah.
Right, but it would be nice.
We get it for a couple of days. That's about it.
I remember it well. Yeah.
Well, this is amazing. I'm just first of all, I love your story, and I love the fact that both of you guys came on. I don't really often have couples, or two people, let alone couples, who have such a beautiful love story and have such a beautiful life story, and the whole story is so inspiring, and I'm actually really pleased. Is really happy to hear about this and to see that something like this exists for so many women. And like I said, I mean, even for me, we can only go so far. And a lot of times if it's blocked, I mean, you suggest surgery. I mean, that's one thing that even as acupuncturists, we hit walls.
Yeah.
Right.
So I think it's amazing.
Of course. None of us cover all of it. So we do have a little book out on Amazon. You can get it on Kindle for 99 cents called Adhesions. So that explains, talks a lot about adhesions. So it's a good educational, inexpensive and very accurate educational resource.
That's great.
It's not really about us. It's just about what we've learned about adhesions and how they form in the body and some suggestions of what can be done about them.
And do you have any books about the technique or any lessons or something, if somebody can't afford to come out, or I guess there's nothing really to compare.
We really
need to clone. I think you need to clone yourselves.
We're so picky of great therapists.
Yeah. You have your own specific technique. Well, it's amazing. I mean, I wish I could box it up and, like I said, but it's just amazing. Yeah. So if somebody were to want to find you guys, you had mentioned the website, but mention it again. I'm also going to post it in the episode notes. Okay. So how would people be able to find you?
The website is Clear Passage, clearpassage.com. There's a little place at the top right of every page, a little picture of Belinda on the phone in a little golden box, and click that. It kind of walks you through. Would you like some information, or would you like to complete a medical history form? And if you do complete a medical history form, it may take 20, 30 minutes to complete the form. It's pretty thorough. We will get back with you and tell you we think you're appropriate, we don't think you're appropriate, we think this could help. So that's probably the best way to learn about us. There are ebooks people can download there for free. A lot of patient testimonials. So if you have endometriosis, or you have, there are video testimonials, pelvic pain, pre-IVF, people from all over the world that we've treated. So that it's a good resource we're not very salesy. We're more like, I want to give you this information.
Yeah, we like educating people.
It'll strike you. If this feels right to you, then you're going to ask for more information, and it seems to feel right and to work well for a lot of infertility diagnoses.
Yeah. I also offer a free 30-minute phone consultation once someone has filled out our long medical history form, and for people who have specific questions about the work that we do.
That's amazing. Well, this is definitely a real gift. And you guys also, you'd mentioned doing a retreat, a 40-hour? Was it?
No.
Or 20 hours?
No, it's generally speaking, most people fly in to one of our locations on the weekend. They start on Monday morning to get 20 hours of treatment during the week, 4 hours a day, 2 in the morning, a break for lunch, to walk around, 2 hours in the afternoon. And they're done on Friday afternoon. They can go home. They can go home Saturday, whichever they prefer. But that's what all of our data and all of our published data is based on, that 20-hour program, which was suggested to us from this researcher, a senior researcher at the National Institutes of Health. He said, yeah, that's about right.
Yeah. And for some people who live close to one of our locations, they can spread their treatment out as opposed to doing the 1 week intensive, where they could come a couple days a week, or whatever worked for our therapist and the patient.
Right. Amazing. Well, thank you guys so much for coming on. This was a real treat, and I'm definitely wowed. It was really, really cool. Very, very cool.
Thank you. You're very sweet, very kind.
We appreciate you having us on.
Yeah, thanks for having us.
Thank you for all the work that you do.
Absolutely. Oh, thank you. This is a real pleasure.
Yeah. It's wonderful. All your podcasts and your website and everything. So congratulations to you. We really appreciate you very much.
Oh, thank you.
We are not alone in that.
No, I mean, I think a lot of us fertility professionals are very passionate about it. Correct. We have that in common. I haven't met one that's not really, really, really into it. Yeah.
So I think. And I saw you started out as an architect.
I did.
Yeah, my sister's an architect.
Oh, is she? And she lives close to you, or?
Oh, no. She's retired from New York City. They're out in Santa Barbara now.
Oh, I worked in New York City.
Oh, okay.
That's where I worked. Yeah, that's where I got very imbalanced and went to an acupuncturist myself.
No wonder imbalance can happen in Manhattan.
It can. It's fun, but it's definitely it can move things around.
Yeah. So good.
So that's definitely interesting. But so I went to I had my own female period problems, and that's what got me into acupuncture.
Yeah, that's great. Yep. Usually there's no greater motivator than trying to fix ourselves, is there?
Oh, totally. And then you get so into it. You're like, oh my God, this stuff's amazing. Yeah. I want to do this all the time.
Yeah, that's great. Good for you. Yeah.
Well, thank you so much, guys.
Thank you. Thank you. Yeah. You're such a bright lady. You've got a lovely personality, and we've really appreciated and enjoyed it.
Oh, thank you. I love you guys. I want to keep you.
All right. Well, yeah. Thank you so much for having us. We really enjoyed it.
So that concludes today's episode. You can find all the links mentioned on the episode notes. If you're enjoying these episodes, please take a moment to leave a review. Reviews are everything to podcasters. You can find me on my website at www.thewholesomelotus.com. And please be on the lookout for my online course and program. This course has emerged from everything that I've been using for the fertility program I now offer at my office. I wanted to consolidate all of my suggestions and coaching and put it into a form that anyone can purchase and use. It was important for me to encompass key fertility health factors, as well as guide you in implementing changes in your routine that are shown to boost fertility while being realistic and user-friendly. I will be offering this course with and without coaching. If you're interested and want updates as well as a free ebook on my top 10 fertility boosting habits, you can visit my fertility page on www.thewholesomelotus.com, where you can find the subscription form. I thank you so much for listening in and hope you have a beautiful day.